At Aarca Research, our focus has been figuring out, using technology to figure out early detection of metabolic conditions, and that includes type 2 diabetes, hypertension and cholesterol. These metabolic conditions takes like 10 years to develop, and today there is no technology that is actually able to do this early detection as early as 7 years or 5 years. So we have developed a solution in figuring out early detection of these three conditions as early as possible, so that people have an opportunity to delay developing these conditions itself. It's interesting to be first of its kind, right? As you rightly mentioned, it has its own set of benefits, and it also has its own unique set of challenges. So a typical startup might be having its challenges in its own way, and we being a healthcare and then research and then a technology has like an extra layer of making this like a first of its kind, even in a tougher situation. Nobody has the data that we have about their health. So that is the one factor that what we have, right? The early detection itself. And the fact that it is non-invasive, people are actually more encouraged to take this test multiple times. We actually wanted to know what sort of an impact we are able to create with this report. And to my surprise itself, actually, and to my pleasure, we actually have about 97% positive rating from the customers, saying that it actually made them think that they want to do something about their health. We have launched our product in the market in the last 6 months, and at this moment we have done about like I think 6,000 screenings, and we are through our partners we are estimated to do about like 50,000 screenings by end of this year. We have been fortunate enough to be part of a couple of accelerators here in India and in the US, but then JioGenNext has been completely different in that way, because the focus has always been about like almost in every call team focuses on like just how are you going to grow. So you know it's very happy as a startup to hear those words again and again from the teams who are organizing this program. We are currently in the early revenue generation phase here in India and a couple of other markets outside of India, but our focus is to get to FDA as soon as possible. We are in the process of going to apply for it and then get the approvals done, and once that is done, I think we are focusing on going to the markets like in the US and European Union and other developed markets.